Hello, and thank you for joining us today. My guest is Laurie Bodenheimer, Associate Director of Healthcare and Insurance at the Office of Personnel Management. Laurie, thank you so much for being here. It's a pleasure to be able to talk to you today.
Same here. Thank you, Drew.
Absolutely. So, going into open season this year, I know there are several changes for enrollees. First, in terms of the benefits that they will have access to through the FEHB program. So, Lori, can you just off the bat here give a couple examples of maybe some of the important changes or updates that you think participants should be aware of going into open season this year?
Of great significance is that we have many more FEHB plans who will be offering added fertility services, especially in vitro fertilization or IVF services. Seven of those plans are new for 2025. We now have two of our large nationwide fee-for-service plans that are offering coverage for IVF. So there is a choice that everyone who is enrolled in the FEHB program has, as well as a number of our community rated or HMO carriers in different pockets across the country. And so we know this is a benefit that many of our younger federal employees need to avail themselves of. And so we're pleased with our progress in that arena. And there is a document on opm.gov that goes through all of the plans that are offering IVF services and more specifically what those benefits are, as well as a link to more details for each of those plans. So if that's something that you're interested in or a service that you think you might need in 2025, encourage you to look at that and do that research early in the open season. In addition, we continue to support the Biden-Harris administration in overall women's health, maternal health. We know that access to good maternal care can be challenging in some parts of the country. And so we are expanding the types of providers that can help with that. We're very focused on postpartum depression and making sure that women have access to care when needed. And when I say expanding coverage, more plans are covering nurse midwives, lactation specialists, doulas. Sometimes that varies because they're subject to state law. Not every state has licensure requirements for all of these types of providers. So do check your plan for that sort of coverage, depending upon where you live. And with respect to mental health, we certainly know that coming out of the pandemic, a lot of people, had a need for behavioral or mental health services. Some people certainly report that they struggle to find a provider, whether they're in network or out of network, just struggling to find a provider who is accepting new patients. We continue to work with carriers on the adequacy of their mental health networks, and it is an area of focus for us. And also continue to focus a lot on the prevention and treatment of obesity. We are one of the largest employers that offer coverage for GLP-1s. As you might imagine, the use of that has increased significantly, but that's not enough. I mean, the successful treatment of obesity, and I'm not talking about diabetes here, but obesity is a really comprehensive program of nutritional management and other factors in order to be successful in both losing weight to get to a healthier weight and to maintain that healthier weight. So that is something we've been closely working with our plans are. So those are some of the big changes.
Excellent. Thank you. I think that's just important to kind of go over some of those significant changes there that will be accessible through the FEHB program this year. I am kind of curious too, Lori. throughout, I know we're in open season now, but throughout the year, what does the process look like with how OPM works with carriers in terms of negotiating the benefits that are going to be available and the costs of all of that as well?
It really is a year-round process for us. We issue what we refer to as a call letter, and that's publicly available. It's always on our website, where we say what are our priorities for the next benefit year. That comes out early in the calendar year. Maybe late January into mid-February. And it's, sort of our call, if you will, to all of the carriers. These are the things that we're focusing on. These are the things that we want you to propose benefits to us on. Now, their proposals are not due till the end of May, but there is already, as soon as that call letter goes out, the carriers start to informally engage with us. Well, we were thinking about this. How would you feel about this change? Or, our trend here is we're seeing a lot of need here, and so we wanted to see if we could respond to that. But we need those actual proposals in house to sort of actively negotiate with the carriers, and it is a negotiation. And we try to keep a number of things in mind. We know that the cost of health insurance, it never goes down. It always goes up. And in this year, as I'm sure we'll talk about, it went up a lot more than we had hoped for. But, we want to try to keep those premiums affordable and reasonable at the same time as we get feedback from our many stakeholders. And that's not just our members, it's members of the Hill, it's other parts of the administration. We try to keep aligned with, especially with the Department of Health and Human Services, which manages the Medicare program, which many of our annuitants are covered under. To try to balance all of that, in addition to maintaining what we refer to as a competitive marketplace. The FEHB program, and soon to be the PSHB program, operate in a marketplace. The carriers and the plans compete against each other. And we want to make sure that that is a healthy competition, that we don't, perhaps overly advantage one plan versus others. And so all of this goes into the mix as we work through benefit changes and what impact that may have on premiums and the health of the marketplace and each of the carriers overall.
Right. And one I think that this year especially it is kind of important to point out, like you said, that premiums are going up pretty significantly. The participants share is going up on average 13.5% for the FEHB. I know there's a portion of that the government's share is going up as well. And you mentioned that it is market based, but can you go into maybe a little bit more detail about what are the factors that play into those premium costs and maybe some detail of how that breaks down between what participants are paying versus what the government's share is paying as well?
We are not alone in having higher premium increases this year. It is a trend that because we do monitor, how other large employers are doing, what's happening in other marketplaces with state governments, with other large payers that we keep track of. And so overall, everyone is experiencing the same thing for a lot of the same reasons. The cost of drugs continues to increase, and that's fully 1/3 of the premium in the FEHB program at this point in time. Our average age is perhaps a little bit higher than a lot of employers. The average age of the federal employee, I think, is in the late 40s now, and it's been sort of creeping up. And the other thing to remember there is we cover, as we like to say sometimes, from womb to tomb, right? I mean, you can be covered under the FEHB program from the time you become a federal employee or you're born into a family where there is at least one person who is a federal employee. And you maintain that coverage as you retire and become an annuitant. And Obviously, as we age, we tend to need and more medical services to maintain as good health as we can for as long as we can. But that both makes us unique and I think in a good way that we have that commitment to our entire federal community to offer coverage. And we're all in what's called one risk pool. We don't separate out by age or any other factor. We're in the pool together. So having said that, that sort of sets the framework for our enrollees. You know, our carriers have been experiencing increased claims, you know, as we have come out of this pandemic. Um, you know, during the pandemic, there was deferred care. People were not going to the doctor. They were, you know, deferring preventive care, all sorts of things. That is done. We're back to fully functioning in terms of, you know, how people and when they're accessing care. In addition, you know, carriers will be renegotiating with all of their provider networks. That doesn't happen every single year. It seems to have been more of a, you know, that's having an impact now on the actual premiums and the claims experience that the carriers are reporting to us. And so all of this together sort of came at the same time. Outpatient care is going up. You know, the market is condensing in terms of large provider groups, which can have more of an impact in their negotiating stance with the various health insurance carriers. All of that, plus GLP-1s, I have to say, have been um, a significant cost increase. And what's not yet clear with them is, you know, they have a long-term promise to maybe decrease the cost of care, right? If you have diabetes and you're able to lower your A1C and maintain that lower A1C, you'll probably have less complications from diabetes than you might have had otherwise. But we won't know the savings that potentially can arise from that for several or a number of years. And so, but we know that in this moment we have to pay the costs of the care that people are using and experiencing. And so that's both a retrospective, you know, this is what we experienced last year, as well as trying to look at the crystal ball and say, all right, so what do we think will be our claims experience in the next year? It's both an art and a science.
Right, and I'm sure that just all of that cost and the thought of you know, what my premium will be is a huge question for people as they're heading into open season this year. I'm
Mhm.
wondering if you have any recommendations or suggestions for what enrollees can do to try to at least understand where they might have some cost savings available to them.
Yeah, I mean, I can't encourage or stress enough that this is the opportunity to shop and to ask some questions, both within your own family and of the various carriers that you are considering. You know, to visit OPM's open season webpage, which is www.opm.gov/open season. It will be it might some of the information might already be out there, but it's always available before the first day of open season, which is Veterans Day, November 11th this year. So we have a lot of resources that are available there. You know, helping you find which plans you can choose from. You know, you think about this, every single FEHB enrollee can choose from, I think it's 17 nationwide plans, plus, depending upon where you live, additional local or regional HMO plans from which to choose. So look at the premiums, look at how that plan is performing on its quality measures. Look at how much, think about internally at home, have I and my family members used my FEHB and FEDVIT benefits in this current calendar year? And do I expect any changes for that in 2025? Now, we can't always anticipate coming down with a major illness or regrettably having some sort of accident or injury that can change how we will access healthcare. But do you have planned surgery that you'll know will happen in 2025? Do you hope to achieve a pregnancy and add to your family? Those kinds of things, you can anticipate that that will impact your healthcare costs. Um, Look at the way that we calculate premiums for both the enrollee share and the government share is based on a formula that's set by statute. And because of that, and it's a little quirky, I'll say, uh, I won't be able to explain it very well, but um, some plans get the benefit of the entire government contribution, and some costs are higher and the government can only contribute a certain amount. And after that, it is the enrollee. So look at that. Make sure that you are getting the advantage or the benefit of the entire government contribution. And don't over insure yourself. I mean, look at the balance between what the premium is and what the member cost sharing is. And again, keeping in mind how you'll use your health care, and do a little math, and try to figure out, okay, do I want a lower premium no matter what? And I'll take the higher cost sharing, or is it more important to have some certainty there? I'll pay a higher premium and balance that with perhaps lower cost sharing. So those are all things that we would encourage people to think about, um, and in advance of open season. Even you can start now.
And I understand that also OPM has a plan comparison tool on its website, which I'm sure you already mentioned. But can you just explain or walk through, when a participant opens that webpage, what does that look like and what are they able to do with that tool?
It'll be different in the Postal Service Health Benefits Program this year, and we dearly hope to be able to enhance the plan comparison tool for the FEHB. It is a bit of an older tool at this point, and we know that it requires a little bit more effort on the part of enrollees to really dig down for the information that they need. So it will. You can go into opm.gov/open season and find all the plans that are available to you in your service area. It will have links to all of those plans. It will have links to all of those plan brochures. Um, but if you're looking for specific benefits, you do have to either look at the brochure or contact the plan directly and ask questions about a particular benefit that you're interested in. We're not able to offer you the opportunity to compare, for example, IVF benefits across 3 or more plans right now. That's why we put that chart out there, because we know people will be interested in that. You can see what the premium is, and the by pay period, because that can vary, obviously, if you're an annuitant or an active employee. Um, so um, that's pretty much what the plan comparison tool can do for you. Hopefully help you narrow down, but if you are considering a change, you will need to dig a little deeper and do a little bit more research on a plan by plan basis.
And again, all those plans, plan brochures, that information is available through OPM's website, correct?
That is correct. And each carrier will have the brochure on their own brochure or brochures on their website as well. So you can find it in both places.
Thank you. One other part of the equation here that I did want to get to, and you did touch on this earlier a little bit, but just the way that Medicare works in the FEHB program. I know there have been, just in the last couple of years, some changes on how that all works together. So can you kind of just walk through, what Medicare eligible annuitants should be aware of if they are part of the FEHB program?
Over time, when most people were covered under the civil service, the CSRS retirement system, um, they relied on their FEHB coverage more so because they hadn't paid into Social Security, they weren't eligible for Medicare. That pendulum has completely shifted now. The vast majority of federal annuitants are covered under the Federal Employee Retirement System, which we refer to as FERS. And so all of those annuitants are eligible for Part A, and have the option whether to enroll in Medicare Part B. Many of our FEHB plans have offered incentives, if you will, to encourage those annuitants to enroll in Part B. They will waive cost sharing. Some of them even help to cover the cost of the Part B premium, to encourage folks to enroll in Part B, but it is still entirely optional for that federal annuitant whether they want to enroll in Part B or not. Because they will have their FEHB coverage that covers many of the services that Part B covers, physician visits, outpatient care, a number of other services. So it's an individual decision based, again, on your individual circumstances. Most federal annuitants do not need to and choose not to separately enroll in a Medicare Part D plan, because we have very good pharmacy and prescription drug coverage in the FEHB program. But beginning in this plan year, 2024, we did begin to offer what are known as Medicare Part D employer group waiver plans, also known as EGWIPs. And we did that because we thought there were only upsides and no downsides for our FEHB annuitants. So the upsides are, especially with passage of the Inflation Reduction Act, you will get the benefit of those protections that Medicare has now put into place, negotiating drug pricing for a certain number of drugs beginning in 2026 and continuing to expand. Insulin at no more than $35 cost sharing, an annual out-of-pocket limit of $2,000 if you are in one of these Medicare EGWIPs. And the advantage is you still have the backstop of FEHB prescription drug coverage if there were to be any drug that EGWIP does not cover. A big example of that would be the GLP-1 drugs, or the Ozempic and Wegovy type drugs that Medicare currently does not cover, but the FEHB plans do. So we only saw that as an upside. It was new. There was a lot of confusion around it, and so some people did opt out. They could opt back in this open season period, and we would encourage you to consider that and talk to your plan about that. But that is one way to both save costs for you as an individual, and it also helps to save costs for the program, which would be reflected in the overall premiums that are charged. It will be different in the PSHB program, but I would rather save that for when we talk about postal. So, but FEHB does coordinate with Medicare. If you are an annuitant and Medicare is your primary payer, your claims would go to Medicare first and then come to be coordinated with your FEHB plan. And whether or not you're covered under Part B would determine whether those claims would go to Medicare or come directly to your FEHB carrier. We just are posting some new updated guidance on how Medicare works with FEHB, and that will be on our website. The link is too long for me to talk out to you, but we can certainly share that information, and would really welcome people to look at that and give us some feedback on how we did there. But it needed updating, and we spent quite a bit of time doing that. So I hope it's helpful.
Absolutely, Lori, and we'll make sure that everyone gets that link so they can find more information. Um, but I think it, like you said, it's important to point out that all of this information about Medicare, um, a lot of what you said is specific to the FEHB program, and we can definitely talk a little bit more about some of the nuances and how that might look slightly different for postal enrollees in the second half of our conversation today. One question, just quick follow up I had about all the Medicare information. So you mentioned that some FEHB participants may have opted out, possibly just out of confusion, or maybe they just weren't interested in the Medicare options, and that they can opt back in. So I'm curious if there's any late enrollment penalties or anything involved if they are interested in opting back into the program.
If you've maintained your FEHB coverage, that is considered creditable coverage for Part D. So there should not be any late enrollment penalty imposed. But you would need to take that initiative and call your plan and say, I'd like to, if your plan is offering a Part D egg whip, you would need to call them and say, I'd like to opt back in.
And if participants do have questions either about Medicare or anything else with FEHB, would you recommend calling a carrier directly, or is there a way to call OPM? What should enrollees do here?
Well, annuitants, can certainly, there is an active open season call center for annuitants that's managed by our retirement services program office. Um, but there, especially with respect to specific benefits, I recommend contacting the carrier directly.
So, Lori, one other thing that I did want to ask you about here is FSA feds and the availability of a flexible spending account to federal employees. What should they know this year going into open season about that?
So FSA Feds is, in my opinion, one of the most underutilized benefits that we offer to employees, and I'm always puzzled by that. It is an opportunity to reduce your taxable income, which means you pay less taxes overall, and you can cover the cost of your co-payments, co-insurance, deductible, or even services that aren't covered by your FEHB plan, at a considerable savings when you take into account both federal and state taxes. We always permit in our plan the maximum contribution that the IRS permits. And right now, it's a little bit over $3,000. They generally let us know after open season starts what the amount will be for the next calendar year. But our contractor, FSA Feds, will reach back to those enrolled. So if I elect the current year's maximum amount and the amount goes up $100 or $150, let's say, they'll reach out to me and say, do you want to increase your election to the maximum amount? So they, people have that opportunity. But it is, for dental expenses, for healthcare expenses, again, things not covered by your health plan or certainly not covered in full, or for which there is a visit limitation, like for rehab benefits, for physical therapy, there's often a maximum number of visits per year. And if you have a condition that needs more than that, you can take advantage of a flexible spending account. There is also, as long as you continue to re-enroll in the FSA, there is a rollover. So you don't have to be as concerned about as some people are, losing part of that election. So, carefully consider what your out of pocket expenses will be, make that election, and take advantage. And so with paperless reimbursement, it's a terribly easy process. You will automatically be reimbursed for anything that your health plan processes on your behalf. If you choose that option, or you can, easily now upload a claim and have that be reimbursed to you directly. So I highly encourage people to consider a flexible spending account. Join your about 520,000 other federal employees in using that benefit. And then on the dependent care side, as well, a huge expense for a lot of families, especially in this DC area. It can help to, yes, you can also deduct childcare expenses off of your taxes. But if you talk to any accountant, um, it's usually a better idea to never have paid that tax to begin with than to try to, put in an expense and lower your taxes once the calendar year has ended. So dependent care, elder care, summer camps, even for your school age kids, are all expenses that can be covered under a dependent care flexible spending account. So I highly encourage you to look at that.
Right. It sounds like what you're saying is there's so many reasons to do it, and you're making it trying to make it as easy as possible, as easy as ever to get those claims reimbursed. So it's very important information there to hear. One last area, final area that I did want to talk about with you, Lori, just in the first half of our conversation here, is about dental and vision insurance through FEDVIP. Um, can you tell me about any maybe significant changes this year for FedVIP, or what else participants should know going into open season again?
So FedVIP has, grown to be a hugely popular benefit program for our federal population, and is inching up, if not exceeding, FEHB enrollment. So it's got the highest enrollment, I think, of all of our benefit programs. Not too many changes for this year. Also, minimal premium increases in FedVIP. Um, but do look at the regional plans tend to be a little bit more affordable than some of the national dental plans. But look and see what works best for you. Most of them will cover braces, and of course the balance could go to your flexible spending account. So do keep that in mind. Um, uh, and think again about your family needs. Are you fortunate enough that members of your family only need routine dental care? Has your dentist told you recently, oh, you can expect that you'll need a crown or some other significant dental work in the next plan year? Does your child, or even you as an adult, could benefit from braces? Are you considering LASIK surgery, which would be an argument for enrolling in a vision plan? So those are the types of things that you should consider, whether or not FedVIP makes sense for you.
Thank you. And just wrapping up this first part of our conversation here, Lori, just overall, what is one key thing that you would want employees and annuitants in the FEHB to just take away from our discussion today?
To take the time to do the shopping, and to ask the questions and be a fully informed consumer. I know it's complicated. I know it's so easy to say, oh, I'll get to that, and then all of a sudden it's the last day of open season and you're like, oh, I'll do it next year. But especially with the premium increase this year, you know be smart and do that shopping and ask the questions to try to make a good choice for yourself and your family.
Thank you so much, Lori. And I know we're going to be talking more later on today. But in the meantime, just thank you so much for your time.
Thank you.
We've been speaking with Laurie Bodenheimer, the Associate Director of Healthcare and Insurance at the Office of Personnel Management. Now we're going to take a short pause here for an industry perspective. So stay tuned for part two of our conversation with Laurie here. After this short break, I'm sending you back to the studio now for more on the open season exchange.